Chapter 67, Acute Respiratory Failure and Acute Respiratory Distress Syndrome. Question: to evaluate the effectiveness of ordered interventions for a patient with ventilatory failure, which diagnostic test will be most useful to the nurse? Answer is arterial blood gas analysis. ABG analysis is most useful in this setting because ventilatory failure causes problems with CO2 retention, and ABGs provide information about the PaCO2 and pH. Next, while caring for a patient who has been admitted with a pulmonary embolism, the nurse notes a change in the patient's oxygen saturation from 94 to 88. Which action should the nurse take first or take next? Answer is increase the oxygen flow rate. Increasing oxygen flow rate will usually improve oxygen saturation in patients with ventilation perfusion mismatch, as occurs with pulmonary embolism. Because the problem is with perfusion, actions that improve ventilation, such as deep breathing and coughing, sitting upright, and suctioning, are not likely to improve oxygenation. Next, a patient with respiratory failure has a respiratory rate of 6 breaths per minute and an oxygen saturation of 88. The patient is increasingly lethargic. Which intervention will the nurse anticipate? Answer is endotracheal intubation and positive pressure ventilation. The patient's lethargy, low respiratory rate, and SpO2 indicate the need for mechanical ventilation with ventilator-controlled respiratory rate. Administration of high-flow oxygen will not be helpful because the patient's respiratory rate is so low. Insertion of a mini tracheostomy will facilitate removal of secretions, but it will not improve the patient's respiratory rate or oxygenation. CPAP requires that the patient initiate an adequate respiratory rate to allow adequate gas exchange. Next, the oxygen saturation for a patient with left lower lobe pneumonia is 90%. The patient has rhonchi, a weak cough effort, and complains of fatigue. Which action is a priority for the nurse to take? Answer is assist the patient with staged coughing. The patient's assessment indicates that assisted coughing is needed to help remove secretions, which will improve oxygenation. A 2-hour rest period at this time may allow the oxygen saturation to drop further. Humidification will not be helpful unless the secretions can be mobilized. Positioning on the left side may cause a further decrease in oxygen saturation because perfusion will be directed more toward the more poor ventilated lung. Next, a nurse is caring for an obese patient with right lower lobe pneumonia. Which position will be best to improve gas exchange? Answer is on the left side. The patient should be positioned with the good lung in the dependent position to improve the match between ventilation and perfusion. The obese patient's abdomen will limit respiratory excursion when sitting in the high Fowler's or tripod positions. Next, when admitting a patient with possible respiratory failure with a high PaCO2, which assessment information should be immediately reported to the healthcare provider? Answer is the patient is somnolent. Increasing somnolence will decrease the patient's respiratory rate and further increase the PaCO2 and respiratory failure. Rapid action is needed to prevent respiratory arrest. An SpO2 of 90%, weakness, and elevated blood pressure all require ongoing monitoring but are not indicators of possible impending respiratory arrest. Next, a patient with acute respiratory distress syndrome and acute kidney injury has the following medications ordered. Which medication should the nurse discuss with the healthcare provider before giving? The answer is gentamicin 60 milligrams IV. Gentamicin, which is one of the aminoglycoside antibiotics, is potentially nephrotoxic, and the nurse should clarify the drug and dosage with the healthcare provider before administration. The other medications are appropriate for the patient with ARDS. Next, a patient develops increasing dyspnea and hypoxemia 2 days after heart surgery. To determine whether the patient has acute respiratory distress syndrome or ARDS, or pulmonary edema caused by heart failure, the nurse will plan to assist with insertion of a pulmonary artery catheter. Pulmonary artery wedge pressures are normal in the patient with ARDS because the fluid in the alveoli is caused by increased permeability of the alveolar capillary membrane rather than the backup of fluid from the lungs, as occurs in cardiogenic pulmonary edema. The other tests will not help in differentiating cardiogenic from non-cardiogenic pulmonary edema. Next. A nurse is caring for a patient with ARDS who is being treated with mechanical ventilation and high levels of positive end expiratory pressure, or PEEP, which assessment finding by the nurse indicates that the PEEP may need to be reduced. Answer is the patient has subcutaneous emphysema on the upper thorax. Subcutaneous emphysema indicates barotrauma caused by positive pressure ventilation and PEEP. Bradycardia, hypoxemia, and bronchial breath sounds are all concerns and will need to be addressed, but they are not specific indications that PEEP should be reduced. Next, which statement by the nurse when explaining the purpose of positive end expiratory pressure or PEEP to the family members of a patient with ARDS is accurate? The answer is PEEP prevents the lung air sacs from collapsing during exhalation. By preventing alveolar collapse during expiration, PEEP improves gas exchange and oxygenation. PEEP will not prevent lung damage, fibrotic changes that occur with ARDS, push more air into the lungs, or change the fraction of inspired oxygen delivered to the patient. Next, a patient with acute respiratory distress syndrome or ARDS is placed in the prone position. When prone positioning is used, which information obtained by the nurse indicates that the positioning is effective? The answer is the patient's PaO2 is 89 milliliters of mercury and the SaO2 is 91%. The purpose of prone positioning is to improve the patient's oxygenation as indicated by the PaO2 and SaO2. Next, the nurse documents the vital signs for a patient admitted 2 days ago with gram-negative sepsis. Temperature of 101.2 Fahrenheit, blood pressure of 90/56, and pulse of 92, respirations of 34. Which action should a nurse take next? The answer is obtain oxygen saturation using pulse oximetry. The patient's increased respiratory rate in combination with the admission diagnosis of gram-negative sepsis indicates that acute respiratory distress syndrome may be developing. The nurse should check for hypoxemia, a hallmark of ARDS. The healthcare provider should be notified after further assessment of the patient. Giving the scheduled antibiotic and the PRN acetaminophen will also be done, but they are not the highest priority for a patient who may be developing ARDS. Next, a nurse is caring for a patient who is orally intubated and receiving mechanical ventilation. To decrease the risk for ventilator-associated pneumonia, which action will the nurse include in the plan of care? The answer is elevate head of the bed to 30 to 45 degrees. Elevation of the head decreases the risk for aspiration. Positive end expiratory pressure is frequently needed to improve oxygenation in patients receiving mechanical ventilation. Suctioning should be done only when the patient assessment indicates that it is necessary. Enteral feedings should provide adequate calories for the patient's high energy needs. Next, a patient admitted with acute respiratory failure has a nursing diagnosis of ineffective airway clearance related to thick secretions. Which action is a priority for the nurse to include in the plan of care? Answer is offer the patient fluids at frequent intervals. Because the reason for the poor airway clearance is the thick secretions, the best action will be to encourage the patient to improve oral fluid intake. Patients should be instructed to use the incentive spirometer on a regular basis in order to facilitate the clearance of the secretions. The other actions may also be helpful in improving the patient's gas exchange, but they do not address the thick secretions that are causing the poor airway clearance. Next, a patient with acute respiratory distress syndrome or ARDS who is intubated and receiving mechanical ventilation develops a right pneumothorax. Which action will the nurse anticipate taking next? The answer is lower the positive end expiratory pressure. Because barotrauma is associated with high airway pressures, the level of PEEP should be decreased. Next, after receiving change of shift report on a medical unit, which patient should the nurse assess first? The answer is a patient with septicemia who has intercostal and suprasternal retractions. This patient's history of septicemia and labored breathing suggests that onset of ARDS which will require rapid intervention such as administration of oxygen and use of positive pressure ventilation. The other patients should also be assessed as quickly as possible, but their assessment data are typical of their disease processes and do not suggest deterioration in their status. Next, a patient with chronic obstructive pulmonary disease or COPD arrives in the emergency department complaining of shortness of breath and dyspnea on minimal exertion. Which assessment finding by the nurse is most important to report to the healthcare provider? The answer is the patient's pulse oximetry indicates an O2 saturation of 91%. A decrease in respiratory rate in a patient with respiratory distress suggests the onset of fatigue and a high risk for respiratory arrest. Therefore, immediate action such as positive pressure ventilation is needed. Patients who are experiencing respiratory distress frequently sit in the tripod position because it decreases the work of breathing. Crackles in the lung bases may be the baseline for a patient with COPD. An oxygen saturation of 91% is common in patients with COPD and will provide adequate gas exchange and tissue oxygenation. Next, when assessing a patient with chronic obstructive pulmonary disease, COPD, the nurse finds a new onset of agitation and confusion. Which action should the nurse take first? The answer is assess oxygenation using pulse oximetry. Because agitation and confusion are frequently the initial indicators of hypoxemia, the nurse's initial action should be to assess oxygen saturation. Next, the nurse is caring for a 33-year-old patient who arrived in the emergency department with acute respiratory distress. Which assessment finding by the nurse requires the most rapid action? The answer is the patient's PaO2 is 45 millimeters of mercury. The PaO2 indicates severe hypoxemia and respiratory failure. Rapid action is needed to prevent further deterioration of the patient. Although the shallow breathing, rapid respiratory rate, and low PaCO2 also need to be addressed, the most urgent problem is the patient's poor oxygenation. Next, the nurse is caring for a 78-year-old patient who was hospitalized 2 days earlier with community-acquired pneumonia. Which assessment information is most important to communicate to the healthcare provider? Answer is decreased oxygen saturation to 90% with 100% O2 by non-rebreather mask. The patient's low SpO2 despite receiving a high fraction of inspired oxygen indicates the possibility of acute respiratory distress syndrome. The patient's blood-tinged sputum and scattered crackles are not unusual in a patient with pneumonia, although they do require continued monitoring. The continued temperature elevation indicates a possible need to change antibiotics, but this is not as urgent a concern as the progression toward hypoxemia despite an increase in O2 flow rate. Next, which nursing interventions included in the care of a mechanically ventilated patient with acute respiratory failure can the registered nurse delegate to an experienced licensed practical vocational nurse? The answer is insert an indwelling urinary catheter. Insertion of an indwelling urinary catheter is included in LPN, LVN education and scope of practice and can be safely delegated to an LPN, LVN who is experienced in caring for critically ill patients. Placing a patient who is on ventilator in the prone position requires multiple staff and should be supervised by an RN. Assessment of breath sound and obtaining central venous pressures require advanced assessment skills and should be done by the RN caring for a critically ill patient. Next question. A nurse is caring for a patient with acute ARDS who is receiving mechanical ventilation using synchronized intermittent mandatory ventilation. The settings include fraction of inspired oxygen, 80%, tidal volume 450, rate 16 per minute, and positive end expiratory pressure. PEEP of 5 centimeters. Which assessment finding is most important for the nurse to report to the healthcare provider? Answer is oxygen saturation of 99%. The FiO2 of 80% increases the risk for oxygen toxicity because a patient's O2 saturation is 99%. A decrease in FiO2 is indicated to avoid toxicity. Next, which information about a patient who is receiving Nimbex or citocrassurium to prevent asynchronous breathing with a positive pressure ventilator requires immediate action by the nurse? The answer is only continuous IV opioids have been ordered. Because neuromuscular blockade is extremely anxiety provoking, it is essential that patients who are receiving neuromuscular blockade receive concurrent sedation and analgesia. Absence of response to stimuli is expected in patients receiving neuromuscular blockade. The oxygen saturation is adequate. Next, the nurse is caring for a patient who is intubated and receiving positive pressure ventilation to treat acute respiratory distress syndrome, or ARDS. Which finding is most important to report to the healthcare provider? The answer is red brown drainage from orogastric tube. The nasogastric drainage indicates possible gastrointestinal bleeding and or stress ulcer and should be reported. The pH and PaCO2 are slightly abnormal, but current guidelines advocating for permissive hypercapnia indicate that these would not indicate an immediate need for a change in therapy. The bun is slightly elevated but does not indicate an immediate need for action. Adventitious breath sounds are commonly heard in patients with ARDS. Next, during change of shift report on a medical unit, the nurse learns that a patient with aspiration pneumonia who was admitted with respiratory distress has become increasingly agitated. Which action should the nurse take first? Answer is use pulse oximetry to check oxygen saturation. Agitation may be an early indicator of hypoxemia. The other actions may also be appropriate depending on the findings about oxygen saturation. Next, which actions should a nurse initiate to reduce the risk for ventilator associated pneumonia? Select all that apply. Answer: provide a sedation holiday daily, elevate the head of the bed to at least 30, give prescribed pantoprazole protonics, and provide oral care with chlorhexidine solution daily. All of these interventions are part of the ventilator bundle that is recommended to prevent VAP. Arterial blood gases may be done daily but are not always necessary and do not help prevent VAP.